whole Spanish public health system is one of the best in the world. I'm not even kidding you. And this is based on experience and testimony from other people, that Spanish public health system is one of the best in the world, not even in Europe, okay? But it has got its own setbacks. I'm just coming from the hospital. I want to see a specialist. My back hurts so bad that I need to see someone as soon as possible. They check me, and guess what? I have to do a radiography, but in 1 month time. I said, well, I might just as well die before the 1 month time. And they said, well, we are sorry. It's not based on any preferences, but it is based on order. It's so much accumulated. And that's a setback. What if what is wrong with me is actually something really serious that is going to impede on my health? I gotta wait. So if you're wondering whether you should get private health insurance or just depend on the public health insurance, well, wait for me to share my experiences with you, and then you can decide what to do. Stay tuned. A friend of mine once told me she would never give up anything in the world for Spanish health system. I mean the public health system. And she's right. Listen to her.
The only reason, if anyone asks me, you can give me $1 million, go here. But for that reason, I might deny it and tell you that, I enjoy staying for this, because when I'm not well, I know they have the facilities to help me out. Yeah.
I told you, she's right, and many people will never give up on it for anything because it's one of the best.
The Spanish public sanitary system, I think, is a really good system. You get services for free, so that's a really great asset of the system.
Actually, it's one of the best. Ever since I came to Spain since 2014, I have always been on private insurance. I came here first with a traveling insurance, but I went to the public hospital once and I was literally charged 500 euros. Can you imagine? I was charged 500 euros literally for being fingered by a doctor. Well, he's a gynecologist, yeah. But at the end of the day, in simple terms, I just paid 500 euros to be fingered. Anyway, my health insurance covered that because I didn't have the public health insurance at the time. So imagine, it was just one visit. I went through the emergency to go a gynecologist check me, and I paid 500 euros. No joking. So this is how expensive health care is in Spain. But once you are covered by the public health insurance, God, you're saving yourself a lot of euros, all right? Then from there, I got the private insurance. Why? I've always loved private insurance. Coming from Ghana and knowing how the public system is in Ghana, I was assuming that would be the same thing in Spain. So I was ignorant about that, and I was just using private insurance until 2017. Yes, 2017. When I changed my residence from student residence to a resident that permits me to work and allows me to get free medical services from the government. So from then, I started using the public health insurance. But before then, my very best friend mom, who passed away, may her soul rest in peace, who passed away in Spain, was basically relying on the public health insurance. And the health insurance in Spain is so good that even if you are illegal in Spain and you are sick, they give you free health services. They will never allow you to die unless they do not know it. And that's one thing I love about Spain so much. They care about human lives to that extent. You are illegal. They know that you are illegal, but they provide services for you. So there are places or hospitals or clinics that you can go and register yourself so that you can have free public service even though you are illegal in Spain. I mean, you're illegal, they should just send you back to your country. But no, they don't do that. They still give you quality health services, and that's the same health services they give to their citizens. So it is that great. However, some of the things that are not great about it is the amount of time you need to wait to see a specialist in a case where it might be a very serious case, because not all diseases or ailments shows the actual symptoms that they need to show for you to be diagnosed or for them to have some kind of emergency on your case or to prioritize your case, right? I remember one time I was given an appointment, but the appointment was 5 months after the date, and then eventually I forgot. So that year I didn't do my blood analysis because I forgot the dates. You know, cases like this and this current one that I have. Another thing is the public health insurance in Spain does not cover a dentist expenses or anything. So yeah, that's one thing. I don't think when it comes to ophthalmology cases also it covers that, because I had my eye surgery here and I didn't hear anything like it covers it, but I haven't tried, of course, ever since I changed my residence. So I was basically depending on private insurance. Also, when it comes to buying of medicine, is going to be out of your pocket, so they don't provide that. But there are other severe cases and major cases that, especially when it has got to do with cancer, oh my god, I'm an eyewitness to that. They take care of you, they provide you the most expensive medicine, all that you need, all the treatments, all the surgeries that you have to undertake that will cost you like thousands of euros and dollars and pounds. It's for free, and you might end up spending less than 500 euros or less than 1,000 euros to get yourself some kind of pills or medicine, but the whole procedure is absolutely free. Even if you want to be a single mother and you are in need of a donor, it's absolutely a free services that the public health services here in Spain gives to you and offer to you freely. Even if you were a foreigner, as long as you have a residence here, you are free to medical services. Public health services is the big deal here, and that's one of the best things that Spain has more than any other country in the world, even the other richest country. Spain is not so rich, they are not rich, they have their economic crisis, but when it comes to health, it's one of the reasons why you want to live in Spain, all right? But as I mentioned, some of the setbacks, and this is the reason why I always love to have the private health insurance. Private health insurance is just like a backup, because if you're having only private health insurance, in some cases, especially when it comes to child delivery, the private company will always send you back to the public services. That's what they do here. So you might have a private insurance, okay? It's time for you to deliver. You're pregnant or the antenatal care is being taken or being supervised in a private hospital covered by your private insurance. But when it's time to deliver, in most cases, they will send you back to the public hospital, okay? And so this tells how good they are. And most doctors in Spain will always tell you, go to public hospital, because they have the equipment, they have the infrastructure, they have everything. Even now during COVID period, they are still building hospitals. Like in Madrid, they are building a hospital. They are building a hospital so that they can provide services for major cases. This is how good and how important health is to Spaniards, okay? Now, I will tell you one thing. It would be great to have the private insurance, but don't only rely on private insurance. And which private insurance was I using? I was using Adesla's private insurance, and it was as quick as ABC. All I needed to do is go through the pamphlet that I'm being given by the insurance, and then I will go through the cities, go through the doctors, the specialists, the private ones, and I choose which one to go. It doesn't matter where you are residents at. You can be living in another town and go to the hospital or clinic in another town. It's all up to you, and your insurance covers that. And then I also get a quicker appointment compared to the public health system, all right? That was the advantage that I had there. But in overall, the the public services is super good. So I will advise you, yes, definitely take advantage of the public health service, but it's also good to have the private insurance. Well, if you're working and you have the money, your health is very important, so I'll advise you and urge you to have a private health insurance. Then you are at the point of deciding on which, because there's so many of them in Spain and you don't know which one to go for. I went for Adeslas because I was recommended by a Spanish that I should go for that one. I was highly satisfied by their services because it was all over. It was at my vicinity, it was in the city center, it was everywhere. They had a lot of collaboration with other hospitals, so I could just go, and it was super easy. I was just a call away from all of them on emergency cases, whatever case. It was super easy for me. At the time, I was paying 600 euros a year, and it didn't have any limitation as in how many times you need to go to the hospital or see a doctor or have an appointment. So that was great. But here I have a list of a couple of private insurance services, and you can just decide on which one is good for you based on your budget. But I will recommend Adeslas all the time. Remember, I'm not sponsored to do this video, so it's based on my own experience with them. So you are free to decide to go with them or go with other services which might be better and have a better price more than Adeslas. So here we go. Sanitas Private, which costs average of 100 to 200 euros per month for one person. Adeslas Private Healthcare also covers 164 per month for an individual. And then Assista Integral Private, also 51.30 per month for an individual, and Convenio Especial, which also covers 60 up to the age of 65 and 157 for 65 years plus. Monthly premiums will depend on your health need, your gender, and your age. So here you are with the information and my take on Spanish public health insurance versus the private health insurance and how much you have to spend on it. But I will always say the public health insurance is the best. Always get a backup, and my backup will always be Adeslas. Now have a beautiful day. If you did enjoy this video, please give me a thumbs up. If you like the content that I create on fitness, immigration in Spain, travel in Spain, visa documents, and all of that, don't forget to subscribe to this channel, turn the notification button on for all videos, and then share this channel to people who will need it. It might be useful to someone is looking for an information that I just shared. Please share it. But before then, be you, be bold, be whoever you want to be, say whatever you want to say, as long as you're not hurting anyone. But most of all, be motivated and inspired. And adios.
Stay motivated and inspired.